Hi, everyone. I'm Dr. Bruce Forman. I'm a psychologist specializing in behavioral sleep medicine. That means I help people regulate their sleep without medication. I want to talk to you about an important topic: how medications, both over the counter and prescription medications, can impact your sleep. Because, let's face it, a good night's sleep is crucial for our physical and mental well being. I also want to tell you about a behavioral treatment for insomnia. You may have realized that sleep isn't just turning off your brain and becoming unconscious. Actually, it's a complex physiological process involving different stages and brain chemicals. You can think of it like a finely tuned orchestra. Medications can sometimes act like a rogue instrument that's badly out of tune, disrupting the harmony and making the experience awful. Our brains cycle through various stages of sleep, beginning with dozing, then light sleep, followed by deep sleep, and moving on to rapid eye movement, or what we call REM sleep, which is essential for memory consolidation and neural network recovery. These stages are regulated by neurotransmitters, the chemical messengers in the brain assuring that the stages are in just the right balance. Certain medications can interfere with these neurotransmitters, affecting how we fall asleep, stay asleep, or the quality of our sleep. In my professional practice, I found that this is one of the biggest obstacles for people who take medications to get restful, restorative sleep. Let's start with over-the-counter medications. You might think they're harmless, but some can definitely mess with your sleep. For example, decongestants, often found in cold and allergy medications, contain stimulants like pseudoephedrine. These can make it difficult to fall asleep and can cause insomnia. Similarly, some pain relievers, especially combination medications, may contain caffeine, which can block the absorption of adenosine, one of the neurotransmitters needed for sleep. This can affect sleep quality. Allergy medications might allow you to fall asleep, but then cause awakening with difficulty falling back to sleep. Medications to prevent motion sickness contain some of the very same ingredients. Even herbal supplements, while often viewed as natural, can have a sleep disrupting effect. For instance, some people find that certain herbal remedies, while intended to promote relaxation, have the opposite effect. And non-prescription sleeping aids contain some of the same ingredients as allergy remedies. Now let's consider prescription medications. They don't just address what they were prescribed for, but many of these can have significant effects on sleep, and it's essential to be aware of them. Pain relievers can cause excessive sleepiness during the day and interfere with sleep at night. Antidepressants, while sometimes prescribed for sleep issues, can paradoxically cause insomnia or vivid dreams in some individuals. They can interfere with the balance of the brain chemicals and disrupt sleep regulation, as can anti-anxiety drugs, which can cause excessive sleepiness, while statins can cause insomnia, and blood pressure medications, particularly beta blockers, can interfere with melatonin production, a hormone that regulates sleep. ADHD medications often contain stimulants that can make it difficult to fall asleep or cause nighttime awakenings. Birth control pills containing estrogen can cause insomnia, and inhalers for conditions like asthma also have stimulating effects that can disrupt sleep. There's general agreement among medical organizations about what defines chronic insomnia. First, it's important that you get sufficient sleep. The average adult gets between 7 and 8 hours sleep each night. taking longer than 30 minutes to fall asleep is the first sign of chronic insomnia. Having difficulty staying asleep or awakening too early in the morning is another. If you have any of these and they interfere with your ability to function more than 3 times a week and have gone on for more than 3 months, there's a very good chance you suffer from chronic insomnia, the most important sleep disorder. If that's the case, it may be a good idea to check with your healthcare provider. But most medical organizations now agree that the medications should not be the first line of treatment for chronic insomnia. Rather, it's the safe and effective approach called cognitive behavioral therapy, or CBT, for insomnia. It's an evidence-based approach, meaning there's a lot of scientific data showing that it works. Okay, so what's involved in CBT for insomnia? Here are some of the main elements. First, we make sure you're practicing good sleep hygiene. This doesn't mean having clean sheets, though that does help. It means sleeping in a room that is cool and dark with no distractions, like a noisy neighbor. We also use stimulus control to assure that there's a strong association between lying in bed in the dark and sleep. This means using the bed only for sleep and intimacy. And you also get a pass if you're sick. We may also work with worrisome thoughts, like if I don't sleep tonight, I will have a terrible day tomorrow, and it will be awful. There are also a number of other strategies a CBTI therapist can use to help reset the sleep-wake circadian clock. So, what are the key takeaways? If you're having trouble sleeping and you're taking any medications, consider that your medications may either be a cause or a contributing factor. If that's the case, whether you take over-the-counter remedies or prescription medications, you may want to speak with your healthcare provider. You can even speak with a pharmacist who can help you identify if your medication is at the root of your sleep problems and explore alternatives. Sometimes it's as easy as just changing the timing. Or your healthcare provider can adjust the dosage. You probably already know, but this is never a good idea to stop taking medication abruptly without consulting your healthcare provider. This could cause unpleasant side effects if not properly tapered. If you think you may suffer from chronic insomnia in spite of your medications, consider seeking cognitive behavioral therapy for insomnia. It's the most effective treatment available and doesn't rely on any medications. Thanks for tuning in. I'm Dr. Bruce Forman, wishing you good sleep and pleasant dreams.